We will move on to item number 9 of the agenda, which is the COVID-19 staff update. And Marilyn and Leslie are already here. Don't know if Anna is going to join us.
Yes, Anna and Dr. Richardson are both going to join us.
Okay. Marilyn, are you going to kick it off for us?
I am. Thank you. We have actually a lot to provide your board an update about. And, you know, I know that a lot of people are very interested in what tier status we are going to be in this week. We fully anticipate, it doesn't get announced till noon. We anticipate no problems in being moved to the red tier during the announcement at noon. So that's our anticipation, which will mean that by tomorrow, those sectors who are allowed to have indoor under the red tier status will be able to do that. So there will be, you know, an announcement coming out at noon formally, which is not that far away. The other things that I'm going to give a broad stroke overview, and then I believe Anna and Dr. Richardson are going to be providing more detailed information specifically around vaccines. The other thing that's happening, because the state reached last week 4 million doses of vaccine in those areas, in specific areas with health matrix areas that were identified, that once they met that 4 million dosage, they would be making some additional adjustments to the tiers and to the tier chart. And so the blueprint is being adjusted effective April 15th to make it a little bit easier to go metric wise to move through the tiers on case rates. But in addition to that, there are some adjustments in some sectors to capacity and other activities that are allowed in specific sectors of businesses. The other thing that's happening on April 15th is that vaccines will be available for all individuals who are 16 and older. And we are fully prepared to move forward with finding ways to continue robust vaccine clinics throughout the county. Anna's going to be providing an update on some upcoming mass vaccination clinics that are being scheduled later this month and early into May, using the Pfizer vaccine, which public health had been diligently requesting, and we did get two slats or whatever they're called of the Pfizer vaccine, which will allow us approximately 2,300 first dose vaccines for mass vaccination clinics, which is very exciting. Because Pfizer is the only vaccine approved for 16 and 17-year-olds, this is really an opportune time for our community to get their children 16 and 17 years of age vaccinated. So please keep a lookout for that. The other thing that we're expecting to occur soon are some adjustments to how small county case rates are looked at in the tier movement, rather than doing the calculation of 10 per 100,000 and figuring out what that means to a county of 18.4 thousand people. Looking at actual cases in the county and having some more leeway as far as what it would take to move to a more restrictive tier. And we're expecting that the state will finalize that sometime soon. But the other thing that we want to update your board on is we received notification that I believe over 6 million doses of the Johnson & Johnson vaccine have been distributed since it was authorized. And there have been a recent handful of 6 individuals who experienced some very rare clotting condition that, while rare and impacting a very small percentage, it is of concern enough that there has been a pause placed on the vaccine as this gets investigated more thoroughly. So I think Dr. Richardson can talk about that and in more detail, and also talk about that these are not the kinds of things that are being experienced with the other messenger RNA vaccines. So this is, we don't want to look at this as a barrier or a reason not to get vaccinated. We will continue to have the Moderna. We will continue to have the Pfizer when it's available. So, Anna, I'm going to have you take it on over.
Thank you. I'd like to provide just a quick update on our vaccine efforts. As of the very end of last week, we were tracking to have between 35 and 36% of our total population fully vaccinated. I believe right now the state of California overall is approaching 20% fully vaccinated within the entire population over the age of 16. The percentage I shared for Inyo County is a percentage of our total population. So when we look at, because we've had fairly limited amounts of Pfizer, and that has been targeted not necessarily to our younger age groups to date. Looking at our population over the age of 18, we're approaching a 45% vaccination rate. So we're really, really pleased with vaccine rollout and uptake in our community. Really want to thank all of the community members who've been watching and reading our vaccine updates and getting into appointments. This is, as we know, one of the ways we're going to be able to move beyond this current pandemic, and really, really pleased with how vaccine is going so far in Inyo County. Marilyn mentioned that we are getting some additional Pfizer. Now, we're not typically allocated Pfizer vaccines, so we were very happy to learn that we are getting 2 boxes of Pfizer, 2,300 doses. That's all can be used for first doses. We're working on the details of some pop-up mass vaccination clinics, but I would like to share that at this point, we are feeling very confident that we're going to be doing a clinic in the Bishop area at the fairgrounds once again on the 24th and 25th of April, working through some of the final details around staffing so that we can also start reaching out to our volunteers in the community as well. So at this point, appointments are not posted. As of the 15th, as Marilyn said, eligibility statewide opens up to everyone over the age of 16. So as of the 15th, we're going to start working on getting appointments posted for those, for that clinic. Anyone over the age of 16 will be eligible within Inyo County for those vaccines. So we're going to actually increase the amount that's available. We're anticipating about 1,500 available for that clinic. Soon after that, and we don't have all of the final details worked out, so I don't want to share a date quite yet, but soon after that, we will be also administering a clinic in the Lone Pine area, same parameters that we would be opening that up to anyone over the age of 16 using the Pfizer vaccine. That again is a 2-dose vaccine, so we would be having a 2nd dose clinic later in May for those, for anyone who's vaccinated with that vaccine. So keep an eye out for our vaccine update later this week. We will be posting those appointments after the 15th when that eligibility goes into effect, and otherwise continue to have appointments available through our vaccine provider network. For the most part, that is Moderna vaccine that's available, several locations in Bishop and also in Lone Pine via our Toyabe, Southern Inyo Hospital, Northern Inyo Hospital, Vaughn's, and Valley Health Center. And again, temporarily at this moment, while we're tracking the review of the Janssen vaccine, we've temporarily halted administration of that Johnson & Johnson or Janssen vaccine locally, and will be receiving a lot more information. There are several federal and statewide advisory committees meeting to review the data that we've had, and I'll turn it over to Dr. Richardson to provide a little bit more information there on that vaccine.
Yes, good morning. This is Dr. Richardson. As Marilyn and Anna have stated, there has been a pause in the Johnson & Johnson vaccine, and that's due to 6 reported cases out of 6.8 million doses of Johnson & Johnson vaccine administered. And what is happening is there's a clotting disorder that occurs extremely rare in these individuals. And most of them in our country have been women. There have been other cases that have occurred in Europe, and they have also been the majority of women. And the cases usually occur 6 to 13 days after the vaccine. It's really important to realize that this is a very rare event, but the CDC is wisely taken an effort to pause the use of this vaccine until healthcare providers and the community is aware of the potential adverse effects and plan for recognition by the healthcare community and providers. It's also extremely important to realize that the vaccine that is being used in Europe, which is called an AstraZeneca, it's been approved in 70 countries over there, and they have seen similar findings in the AstraZeneca vaccine. The AstraZeneca vaccine is not given here in the United States, but the Johnson & Johnson is, and they're very similar in terms of how the platform is made for delivery of the vaccine. The Pfizer and Moderna vaccine are not related at all to the Johnson & Johnson or the AstraZeneca vaccine. They have had no reports of any problems in clotting disorder with the Pfizer or Moderna vaccine, and the use has been upwards maybe 100 million doses, where the cases in the Johnson & Johnson vaccine were seen in 6.8 million cases or doses of vaccine given. And that comes to about 1 case per million. So it's extremely rare. And what can occur is you could get a clotting dysfunction in the area of the brain, abdominal cavity, meaning your stomach. You could get leg pain with clot formation and shortness of breath with clots that could move up to the lungs. So the recommendations are to watch for any abdominal pain, severe headache, leg pain, shortness of breath within 3 weeks of the vaccine in those that have already received the vaccine. We have given some of this vaccine out to the public, but the likelihood of having any problems is reported as extremely rare. I think that's where I'll end there and open up for questions. I want to emphasize again that the vaccines that we're giving predominantly in the county, Pfizer and Moderna, are not implicated in any significant side effects such as what I just mentioned. So,
Anna or Marilyn, I do have a question about testing. We're still doing testing. I know that some questions came to me about how do you get tested, and what are the days up in the Bishop area?
Yes, testing is still available in our community-based testing sites. Excuse me. In Bishop, that's Monday and Thursday. The location is the Tallman Pavilion at the Tri-County Fairgrounds. Testing is available between 8 a.m. and 4 p.m. on Mondays and Thursdays in Bishop. Also at Statham Hall in Lone Pine on Tuesday and Friday, same hours, 8 to 4. And there on the county website, there's a link, there's a registration site or a telephone number to call to register for testing. They will accept walk-in appointments as well. So if you don't have an appointment, they do have some availability to be able to register on site.
Thank you.
I have a couple of things, but I'll go.
Oh,
Go ahead,
just-
Jen.
Yeah, I was having trouble with my sound, sorry. You had mentioned a mass vax potentially for April 24th and 25th. When would the second vaccination clinic be?
That would be May 15th and 16th.
Okay, oh, so it's 3 weeks, not 4. I had 4, okay. Right,
A
and
little
then,
bit different between Pfizer and Moderna.
gotcha, okay. And then also thank you for your help with the sports team. Your whole team, thank you for that this past week.
I was out in Southeast County after the vaccines were after your clinic out there, and they were greatly appreciated. People were very relieved to get them. I do, have a little concern about the J&J, that's the vaccine that we used out there. Do we have, is it necessary, or are we making an effort to relay the same information that we got this morning to them? I'm assuming you are, but I'm just asking about it. So.
Yeah, I think it would be a wise idea somehow to get that message out to them, to watch for any symptoms that I mentioned. How that will be done is something that'll have to be decided. But I think it's wise to do that. That was 1 week ago now. Its symptoms usually occur within 3 weeks, oftentimes between 5 to even 20 days out. So I think it's a reasonable thing to do, given the fact that there were only 7 days since they were vaccinated.
Both the Park Service and Xanterra would have good contact for those that area, and then I do think we have a fairly robust email list for Southeast County for the Cope and Shoshone, and of course Rose and Shelley would be helpful. I'll leave that to you how best that gets communicated, but seems like that might be necessary. I have a question for Dr. Richardson on a whole different topic. Our K95 masks, they both protect the person wearing the mask and the person, around the person wearing the mask.
Well, I think it works both ways. As a source control, if somebody is asymptomatically infected and they're wearing a 95 mask, they're less likely to aerosolize the virus if they're wearing the mask. And since the mask filters when you breathe in, it also would protect the individual from a different source than the person wearing the mask.
I have a thought, and it's not well researched and probably not very well thought out, but I'm going to put it out there anyways. As we go out of restrictions, we're still going to have a mask mandate, and there's definitely factions of people who are for and supportive of wearing masks and seem to be against wearing masks. I wonder if an effort to provide K95 masks throughout Inyo County would be a smart thing to do. as we go out of the other restrictions and continue to have a mask mandate, people who are wearing them then would be both protecting themselves and others. People who didn't want to wear masks at all would then be maybe less of a threat to the people who believe in masking. And, you know, I don't know if that's something that we could use our COVID money for. And again, this is not well thought out. You don't have to really respond to it much, but it does seem like maybe an effort like that. It's a thought. I guess I'll just leave it at that.
Well, the masks have a gradation of efficiency in filtering. And as you get up into the KN95 and an N95 mask, they're probably the best filter that one could get, except for a respirator. Whether or not people would wear them, that's another issue. They're a little bit more difficult to breathe through, especially in the summertime, as spring and summer comes up.
Yeah.
If they wore them, I think that would be, every time I see somebody with one of those masks on, I feel in my head that's a good thing to do. They're doing the right thing because it filters the best that we have for the public to use.
I switched over to them. You know, I bought some easy to get off of Amazon, a little more expensive, of course, than regular masks. And I also gave them out to some people, and I just found people were so appreciative of getting them because they felt like I don't know, for some reason, I think there was a perception at some point that they were hard to get or that you shouldn't get them, but now there's plenty of them. And so anyways, just an idea that I thought I'd put out there.
It's a good idea.
I have a couple of questions. So am I correct in assuming that the pause on the Janssen J&J vaccine is probably temporary and short? And go ahead.
Well, I'm not sure about that. Tomorrow, the CDC is going to convene the Advisory Committee on Immunization Practices. And from there should be some information that'll come out. That'll be then reviewed based on after the ACIP reviews all the data that's been collected. Is it going to be short-lived, the pause, or is it going to be longer than a few days? It's hard to know. I wouldn't expect a decision to be made. Probably it'll take at least a week to gather all the data and decide where to go at this point.
Okay, well, I'm hopeful that it's short because I know that we had some allocation coming to us, and maybe it's on hand that we were going to use for mentally ill or people experiencing homelessness. That would be an easier way to protect those folks. And I think we are in a somewhat dangerous state during the transition here as we get a bulk of people vaccinated and people relax, appropriately relax. And, there's perhaps opportunity for some of the vulnerable population to, be exposed to the disease. So I'm hopeful that we can really treat those folks as quickly as possible. And then the other part of that, related to meal days and making sure that meal days is able to happen. We were able to get the state to agree to work closely with our public health department to, make sure that it goes off. But, I think that we are doing great on vaccines at 45% and getting another 2,300 first doses that it sounds like their second dose will happen before meal days. So we really have the opportunity of having 3/4 or more of our population over 18 vaccinated, which is really great. So, which brings up how do we make sure we fill up all of those slots for the mass vaccination clinic? And you know, I'm finally eligible on Thursday, and I have an appointment at 8:30 in the morning to get my first shot. So a couple of questions is one, I know you talked about doing some special outreach with the youth coalitions to our Hispanic Latinx community. Maybe you could talk a little bit more about that, and maybe are there ways that we can help promote vaccine at this point? And are we thinking about what are special enticements we can do to make sure that all of those first doses are used up in our community?
Yes, thank you for mentioning the outreach that we have scheduled tomorrow evening in coordination with our youth coalition. We will be having an outreach at the WIC office in Bishop. That's on Line Street in Bishop tomorrow evening, where we will have both assistance for individuals who speak English and those who are primarily Spanish speaking to be able to register for any of the vaccine appointments that are available in the area, and pre-register. We're starting to collect information to make sure that individuals who are interested in the Pfizer vaccine specifically at the Tri-County Fairgrounds, or once we have our location set in Lone Pine, that we can start to gather their information and make sure that we're able to reach out to get them fully registered once those appointments are available. So that is tomorrow at our WIC office. Once we are through that outreach, we will be looking at doing a similar outreach, at least in the Lone Pine area, to continue to assist people in registering. We've been working especially with our internal equity committee in looking for different ways to reach out and support individuals who are primarily Spanish speaking to be able to increase the number of individuals who have access. We're working on getting more information out through social media, and also are looking forward to seeing how successful this outreach event is in person to help people get registered for vaccine appointments.
Thanks for doing that. Really appreciate that effort.
Do we have any data on how we're doing, particularly in the Hispanic community, with as far as vaccinations go?
Yes, it's just going to take me a moment to get to the right screen for that.
You're always Johnny on the spot with the data.
I have so many
impressive.
screens open right now that it's going to take me a moment.
Marilyn would just make it up, but you're like getting us the real.
I'll give you our actual data currently. We're showing for at least one dose of vaccine. We have 11% of the vaccine administered to Inyo County residents has gone to Latino, an additional 21.2% to multi-race individuals. What this data at the state level does not capture is administration by Toyabe. So while the state level data shows a fairly low coverage rate for our American Indian Alaska Native population, we know that has been an area of focus for our Toyabe outreach as well. So I would say our coverage does not match exactly our overall demographic within the county. I don't have the definition of multi-race, but my impression is a portion of that does capture some of our Latino population as well. So we're doing fairly well in that regard, but definitely want to continue, because we know that there are, what we see nationally, statewide, and also locally is that we can see individuals have worse health outcomes with certain ethnic backgrounds. So we want to make sure that we're continuing to really focus some outreach, not only to the Latinx population, but also the Native American population.
Thank you. All right, Leslie, do you have anything to add for us?
I just really quickly, I just want to recognize that there's been some changes for small counties and just in the blueprint for a safer economy. And I'm getting some feedback from some businesses that things are getting a little confusing again. And so, and I feel a little confused myself. And so I'll be doing a little bit of research and pulling some facts together later on this afternoon. And I will try to get out an email to the businesses that I have on my distribution list by tomorrow, just to sort of bring all the pieces together for our local businesses. I think the biggest fear is that there's a bit of a misconception out there that we can move back to the purple easily if the cases go up, and that's not the case for the small town provisions. So I'll just say that out loud for the public right now, and then I'll put the details in my email, unless you guys have details off the top of your head from the health department. But I will get that information out. And that's all I have for today.
Leslie, I do want to add to that. Thank you for mentioning that, because I agree that there are a lot of changes happening as we start to transition as a result of more people being vaccinated and lower case rates. Changes are happening almost daily. And so I do want to read very directly what one of the recent updates to the blueprint for a safer economy is. And it says, unless there are extenuating circumstances such as low rate of vaccination take-up, a county will only move to a more restrictive tier if hospitalizations are increasing significantly among vulnerable individuals, especially among vaccinated individuals, and both test positivity and adjusted case rates show a concerning increase in transmission. So we know that we don't have the details published yet. I know we're working through the actual final language. There's been through a lot of advocacy, and I want to shout out to our CSAC representatives, Supervisor Griffiths, thank you for your advocacy, and others around recognizing how difficult it has been for some of the small counties with the case rate application. So we are expecting, though it hasn't been finalized, some changes in how those moving into less restrictive tiers get applied, especially for small counties. And we're hoping that information gets finalized shortly. But to move backwards, the state's really looking at not doing that unless there are extenuating circumstances. And this is admittedly written a little vaguely, and we don't know, we don't have numbers associated with that at this point, but really we're trying to move only forward. And we know we're seeing some case rates in other parts of the country, case rate increases in other parts of the country, but really focused on racing against the variants, getting as much vaccine out as possible, and just really committed to trying to meet this goal of moving beyond the blueprint by mid-June. So unless we have some pretty significant changes to hospitalization rates or significant changes in vaccine uptake, we're on track to be moving beyond this blueprint in coming weeks.
Thank you.
Yeah, I think Anna put it really well for what my understanding of it is. I guess I would add that a couple of things. That my understanding is they're not going to write specific numbers into the going backwards. That they've been convinced that nobody wants to move backwards, and so it has to be some sort of catastrophic, obvious to everyone, ICU is full type thing before moving backwards. And that's unofficial yet, but it starts soon, like maybe today. they're coming out with that. I think they said they're announcing it Tuesday. And then a couple of other points is, so the same metric of for our population of not moving backwards. So this absolute case rate of 35, it would take to go to purple. That is, so those same numbers of, I think it was 35, 21, and 14 and 7. That those are now the new numbers for moving into the least restricted tier, as opposed to the case rate, which with those numbers, I believe right now we would be in the orange. However, the one thing that they refused to back down from was the 3-week wait in a particular tier before you could move to a least restricted tier. So assuming everything goes as it's supposed to today, if we move into the red, then it would be 3 weeks in the red before we could move into the orange, assuming our case rates continue to decline.
Correct.
I agree, it is confusing.
Yes.
I guess one other thing to report is it's been requested to write a letter to Senator Borges and Assemblyman Mathis to ask for an event exemption for meal days that will perhaps better facilitate the safe putting on of that event. And so Supervisor Rozier has been working with me to write that, and I'm gonna put it on letterhead and send it out today.
I'm supportive of sending that letter if you're asking that question.
Okay, are we done with the COVID update? Does anybody have any more questions?